Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, where we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers and those who serve them. Hello, and welcome back to another episode of CommonHealth podcast, brought to you by the Virginia Community Healthcare Association. My name is Rae Carkhuff. I'm the Communications and Content Specialist here at VACHA, and I'm so excited to be guest hosting this awesome episode of CommonHealth for you today. Today, we're going to talk about the Check It Out program at Petersburg Public Library, which is a wonderful community resource to help better heart health and take care of blood pressure screenings locally in our community. But to get us going on that awesome conversation, we have to introduce our lovely guests. First, we have Robin Gahan, who's the Vice President of Community Impact for Central Virginia with the American Heart Association, also known as the AHA. She began her career with the AHA nearly 10 years ago as the Senior Director of Government Relations here in Virginia, where she led statewide advocacy campaigns, including Medicaid expansion. Robin is a social worker by training and a change agent by heart. A graduate of Virginia Commonwealth University, Robin holds a master's degree in social work administration, planning, and policy practice. We're also joined by Tabitha Goode, who's a native of Petersburg. Her passion is to serve her community through her work as the manager of growth and community engagement at Molina Healthcare. This derives from seeing her community struggle with their health and well-being and her feeling that folks feel like they've been left behind. At Molina, Tabitha makes sure patients have direct access to the resources they need. Tabitha is a graduate of Old Dominion University. And last, but certainly not least, we have Tera James with us. Tera is a community health worker at our member health center, Central Virginia Health Services. She's an entrepreneur who has owned and run 2 businesses with her husband, a salon and a trucking company. Tera holds a master's from Liberty University and a bachelor's from Virginia State University. And now that the introductions are out of the way, how are you today, folks?
All is well. How are you, Rae?
Doing well. Thank you so much for being here. So let's just go ahead and dive on right in. To get this started, we always like to do an icebreaker just to get to know you all a little bit better. And since we're talking about the Check It Out program that is run through the Petersburg Public Library, we're curious, what's everyone's favorite book? Let's go ahead and start with Tera.
I'd have to say the Bible. That's one that I read the most.
Absolutely. It's also the book that has sold the most copies in the world. So, and how about Tabitha?
See, you're putting me on the spot. I'm an Audible kind of girl, so I listen to books because my eyes aren't as good as they used to be, I guess. My favorite book as of late, I believe, is The House of Eve. I think so. It changes by the week, but recently that was the best book.
I'll definitely put it on my TBR, as the TikTok kids say.
Yeah.
And I'm with you. I'm absolutely an Audible person. I turned 30 and my eyes said time for glasses. So absolutely understand. And Robin, how about you? What's your favorite book? Now or forever? Or
I'm like a voracious reader, so I typically have like a audiobook going, a nonfiction and a fiction at all times. So my all-time favorite book, I'm a big science fiction reader, is Octavia Butler's Parable of the Sower. And her kind of not namesake, but like current author of this generation that's really been influenced by her, N.K. Jemisin. Both those are my 2 favorite.
Somebody just suggested N.K. Jemisin's one of her trilogies to me. So that's very
all
fun.
So good.
Awesome. Well, it was awesome to get to know a little bit more about you all and what you're picking up at the library. But as much as I would love to talk about books with you all, we've got to get down to business. So We're talking about the Check It Out program at the Petersburg Public Library. For those of you who don't know what that is, listeners out there, this is an awesome program started between these three organizations where residents of Petersburg can go into different branches of the library and either receive a free screening on site in special sections or check out blood pressure tools to then take their screenings at home, take care of their health in the comfort of their own home. But before we dive into more about that and this awesome thing that you all have put together and work on every day, we should probably know why we need to be more vigilant about our heart health in the first place. So Robin, could we spend a bit of time maybe talking about some of the stats and facts on heart disease and why this is so important in our communities?
Absolutely. So, nationwide, we know that heart disease is still a leading cause of death in the United States. And when we look specifically at heart attack and stroke, hypertension or high blood pressure, particularly uncontrolled high blood pressure, is a leading cause of heart attack and stroke. And one thing that is clear, whatever community you're in terms of location, population, most people don't know they have high blood pressure. Nearly 50% of the entire adult population in the United States have high blood pressure, and many don't know it. In Petersburg specifically, overall, about 40% of the residents, again, adults, have high blood pressure. And when we look at zip codes and zoom in on census tracts, we can see that there are communities where 60% of the population have high blood pressure. The tools and mapping and data is available to us is really critical to help us prioritize where the greatest disparities in health, both outcomes and chronic disease management, are affecting individuals, families, and communities. But one thing that's really critical to that is it's really partners like CBHS, Molina, and many others who are boots on the ground, if you will, who are seeing the impact of uncontrolled hypertension on individuals in the Petersburg community. And that enriched experience and anecdotal experience is just as important in helping us to prioritize our interventions as is the data.
Absolutely. And that's some really staggering and concerning data. This is a podcast, so nobody can see the way that my eyebrows just hit my hairline at some of those numbers that you just put out there. But you made a really good point that we have the data, but folks who are boots on the ground see it in a different way outside of the data. Tera, I'm wondering if you might be able to speak to some of the things that you've noticed working at CVHS that plays into the staggering data that Robin just told us about.
Well, what I've noticed is people are just not diligent with first being aware of what their blood pressure is. People are not, they're not making their doctor's appointments. What in the field that I'm in as a community health worker, more specifically, I deal with a lot of people who they're dealing with what we call social determinants of health. So when you're concerned about not having housing or not having transportation, not having food, health teams seems to go further down the list, and it's not so much a priority for the people that we serve. And so that's what I see a lot of. So being at the library, meeting people where they are. I have seen quite a few people come through that they don't go to the doctor regularly. They don't. So me being there, they see me. So they say, oh, well, let me get my blood pressure checked while I'm here. So, but yeah, the community that we serve, that I serve, Petersburg and the surrounding Tri-Cities area here, yeah, a lot of people are just, their health is just not a priority. So we're just trying to get the awareness out there, letting people know that it's important that they take care of their health.
Right, absolutely.
Yeah.
And that's the beauty of service provider like CVHS the safety net provider who, in communities where, like you said, you talked about those social determinants of health. If you don't have food, you don't care about your blood pressure. If you don't have this or that, these things don't matter as much. So, but with a safety net provider like CVHS in the backyard, we're trying to get more people to realize, like, you can come into this institution and you can have care. So Tabitha, I am so excited to get you in on this conversation as well. We know that the Check It Out program started with a grant from Molina. Can you talk a little bit about that at its origin and inception and how it moved from there?
Okay, well, as we all know, heart disease can be preventable with the right knowledge and access to proper care. So, with all of the things going on, and especially Petersburg, we want to make sure that we meet people where they are. We say that a lot, meeting people where they are, because as Tera said, they have other things to worry about: blood pressure, diabetes, all of those things are, second thoughts. So reached out to partner with the American Heart Association, and things just kind of ran from there. And we are super excited to have this initiative going with CVHS and AHA.
Love it. All right, then. Well, we have danced around the program. I've said everything but how this program works. So let's dive on in with how does the Check It Out program work? Tera, you're the one who's, as Robin said, boots on the ground a lot with this program. Can you walk us through how this program works?
Absolutely. So the program at Petersburg Library, people can check out a blood pressure monitor just as they would check out anything else at the library, a book or hotspot. They just go to the desk and just fill out the necessary paperwork, and they can check it out, and they would just bring it back, and they're able to recheck it out again if they need to. And that's pretty much it. It's a simple process. And yeah.
I love that. Again, meeting people where they're at. This is as easy as coming in and getting your library book. What about, I know that there are some on-site stations as well. Can you tell us a little bit about those and how those work?
I'm there every Tuesday. I do free blood pressure screenings every Tuesday. I'm there from 12 to 6. And so people are able to come to me and get information. I have information. I can, have conversations around blood pressure, hypertension. And yeah, so I get their measurements, and I have quite a few that come weekly to see me and get their blood pressures screened. So yeah.
I think it's lovely that you're making those connections in the community, because is that not another part of health where these folks are coming out and seeing you, making that community connection and helping with their heart health as well as their mental health? Have you noticed more patients coming to CVHS or heard anything about that since these blood screening options have become available? Has it gotten more people on board with their overall health and wellness?
A few. I will say the majority, no. But there have been a few that I know, because of their interaction with me, their experience with me has caused them to be more aware, more proactive, more involved, and seeing their provider. We've not had, because that's not our goal. Of course, we want them to come to CVHS because I work for CVHS, but I that's not something that I push. I don't push. I encourage them to get the treatment, be seen, by your PCP, your provider, or wherever you're comfortable with going. And CVHS is I throw that out there as an option for those who say they don't already have a provider or going somewhere. But as far as the referrals to CVHS, we're not gaining a lot of clientele from this. As I stated, some of them, they're more comfortable with just coming to see me to get their blood pressure checked. But there have been a few that have shared with me that it has encouraged them to go to their primary care physician, to go and monitor it more at home. So that I've noticed. Yes.
That's wonderful. Thank you for sharing that. And when you first started responding and you had, you said, oh, a few, all I could think about was the starfish parable, that even if you just get one,
Yes.
to come back or go to their provider, then you made a difference.
Yes.
Oh, I love that. So Tera, you're on the ground. You're there all day on Tuesdays taking care of folks. But
Yes.
this is something that, folks can come in and out. They can check things out when you're not there, things like that.
Yes.
So Tabitha or Robin, do you know, are there any types of trainings that get provided to the librarians or the staff at Petersburg Public Library to help with this endeavor?
I can answer that. So that's a great question, Rae, and it's really central to the intervention that the American Heart Association is focused on when we think about meeting people where they are. As Tera and Tabitha have said beautifully, part of it is not only building the capacity of the community members more broadly, or the patrons of the library, to know their numbers, but also to empower and inform the library staff as well. And so anytime we launch with the library, in the past, we've launched some blood pressure screenings and referrals with food pantries. I'm in the process right now of getting some going with YMCAs and barbershops. In fact, working with Tera on that as early as tomorrow. We're launching something in Petersburg. And so all of those people, whether they're librarians, a barber, a volunteer at a food pantry, they're not expected to be the experts on blood pressure, right? But we want them to have enough information that they feel comfortable and competent in pointing people in the right direction. Library staff, they're so good at this. And that's why having a loaner program where you check a device out is really been successful in library settings compared to some other community-based settings, because the library has the infrastructure to do that and do it well. And so if we have Tera there, people are engaging with her, she can, let them know, hey, if you want to check out a blood pressure monitor, you can. We're working with the library to continue to help promote this externally to the public and their members. It's on the website. But a big part of it is the library staff helping encourage people and spreading the word. So having a sign on the desk where folks check out is really important. Just lots of different ways to make people aware of it. And again, we don't want library staff to feel that they have to step in and be a medical expert. And in fact, we had partnered with the VCU Health and Wellness Library, and their library experts to incorporate into the training just some kind of overall information, like what can you and should you and what should you not, say to folks. So, for example, one of the top tips is you don't need to diagnose. People may ask, what does this mean? Does this mean I have hypertension? It's not the role of the library staff to say yes. They would be able to say, well, let's take a look at these materials. We have these here from the American Heart Association, and you can take a look and see what those numbers mean. And based on that, they can have a conversation with the individual and encourage them to follow up with their doctor. Or if they don't have a primary care doctor that they're currently working with, that's where partners like CBHS come in, right? And they're able to help support those individuals getting their hypertension under control.
Right. Absolutely. Oh, I love that. So many thoughts going around in this little hamster wheel of a brain. But first and foremost, just taking a minute to shout out librarians and just how they are truly such public servants. Much like you all are magic, so are librarians. And can we get a little bit more of a sneak peek of your program with these barbers, or should we just have you back when that's off and running a little bit more?
No, I think we can absolutely talk about it. And, I should just add that the American Heart Association, as I lead our community impact efforts, everything we do is science-based. So this intervention of screening people for high blood pressure and referring them to care is really an evidence-based model. And that referral to care piece is critical, because having people check their blood pressure, while very important, is only increasing their awareness. And we want awareness in action so that we can help prevent heart attack and stroke. when we think about meeting people where they are, and again, looking at health disparities, we know that Black and Hispanic people overwhelmingly have higher blood pressure. And so we know there are a multitude of factors that contribute to that, but that's why it's really central to focus on meeting people where they are. And that was really the barbershop specific model, which is not just unique to us in Petersburg. There's actually some scientific literature that behind it. The American Heart Association's scientific journal Circulation has research that was conducted 2019, particularly looking at Black barbershops and how that interface with people in a space in the community where they are safe, comfortable, and have trust with the person who's doing their hair creates this like amazing effect of being able to talk about things like high blood pressure and connecting people with tools and resources. So another level, barber and beauty school, ALBC, which is right down the road from the library. We're launching with them tomorrow to train their students because it is a school. It's a barber and cosmetology school so that they can talk with their patients, with their clients about it and have the information there, have a blood pressure monitor that they can use while they're waiting or while they're in the chair, and to increase that information. And then we're working with Tera and also the Crater Health District, the local health departments, community health workers, to be on site regularly as well for screening. So that way it's not all on the students. But it's such an incredible opportunity because not only are we going to help the community members who come in to ALBC, but these are students. So they're getting ready to start careers in hair, cosmetology. And so wherever they go next, we really hope that we can continue to partner with them and have that ripple effect that they can then bring this information to the community, whether that be, Petersburg City proper, or we're talking Dinwiddie and Prince George County. I mean, really the ability to grow this information and connecting people to care is just really exciting.
Truly exciting. Another thing that listeners can't see right now is just the huge smile that was on my face just listening to Robin and Tera talk about community and having each other's back and using these different safe outlets where people are already coming together, already building community to just further that care for one another. How wonderful and exciting. Tabitha, I want to come back to you for a moment. You are a native of Petersburg. So this is your community. This is your fabric, where you grew up. Doing this work through the Check It Out program, we heard a little bit from Tera in her community health worker aspect, but as somebody who lives in that community, loves that community, have you noticed any impacts from this program?
I would like to say that I guess people are a little bit more aware. The big thing in Petersburg is trust. So even though they're not going maybe to see their PCP, the fact that they're going to see Tera every week, so they know she's going to be there. They trust Tera to give them their numbers. That's what it's all about, because awareness is the biggest piece of this. Again, like you said, I am from Petersburg. I know the stats. I am one of them. My high blood pressure is more genetic than anything else. But I also know that it's very easy to just say, well, I don't want to take my meds today because, I'm going to be running to the bathroom or I'm going to be outside all day. So I don't want to take anything that's going to make me feel tired. So just making people understand that it is important to keep up with your medications. It's important to keep up with your numbers, encouraging family members to keep up with their stuff too, because if you're down, you can't be there for anybody else. Understanding you have to take care of your family, but if you're not well, then who's responsible, right? Not only is high blood pressure, I know we're talking about BP, but diabetes, pretty much all of the things, when you look at the map of Petersburg, you see the stats are out of this world. As a part of our initiative in the city, Molina Healthcare does have one-stop resource center. That one-stop resource center, it's a food pantry. We do diabetes clinics on the second Tuesday of every month. There's also somebody there to take blood pressure. Just again, I don't know, we've pretty much run this in the ground, meeting people where they are. So, yes, would I like to see more awareness? Absolutely. But I think it's a good start with this program at the library, and just knowing that folks are coming back to Tera again and again is magnificent.
Absolutely magnificent. And I don't think it's been run into the ground at all. I think it's just the repetition of a really important point that we need to meet people where they're at. We can't expect them to suddenly, get the urge and come and do all the perfect things for us. And so just really meeting people where they're at and remembering, as Tera started us out with, those social determinants of health, like what is going on in their life that is preventing them. So a really important point. Thank you for hammering it home one more time for us. I am wondering if anyone has any final thoughts, any wrap-up thoughts that they'd like to add about this awesome program.
I would just love to say it is truly the best part of my job and the work that we do at the American Heart Association in partnering with organizations and people like Tera and Tabitha. We are able to do so much more in collaborating together than our individual silos. And I'm so appreciative of the support that Molina contributed to the American Heart Association financially in our overall mission, but specifically in helping us get these resources in the community with, increased blood pressure screenings and the monitors that folks can check out. But we know there's still so much more. And again, if Tera wasn't there to be that familiar face, that comforting voice, we would not be as effective. So I'm just deeply appreciative and grateful of the partners, and know that we're going to continue to grow that awareness and strengthen the action piece. I think it's easy to say and hard to do. And so we're constantly taking feedback and assessing, how could we better streamline that follow-up piece to get people to follow up with the doctor? What can we be doing? And I think hearing from the community members themselves is going to be a really important piece of that, so that we get feedback from them, what's working and what can we do better.
So, Rae, I'd like to share something you when you addressed, even if we just reach one. I had a young lady to come back and share with me. One of her friends was not feeling well. She came to the table. She was there for a meeting, and she came to the table, got her blood pressure checked, and it was elevated. So much so that I was encouraging her to contact her doctor like right away. It wasn't crisis stage where I needed to contact EMS, but it was worrisome. And so she did not get it checked that day. And so what I do is personally, I actually reach out to those who have like an elevated, if their blood pressure is higher than it should be, if it's concerning to me, I'll even reach out to them like the next day and say, hey, did you go get that blood? Did you check it again? What is it today? Did you reach out to your doctor? And so, but because of my persistence with this particular lady, she actually reached out to her doctor. Long story short, the lady ended up, she had a blockage. She had two blockages where she ended up having to have surgery. And so her friend came back to thank me. And she was so grateful and appreciative for our program being there and for me taking that extra step to contact her and push, because she just, she felt bad and she was like, oh, I feel bad. But, she said it was my persistence that encouraged her to take that step and reach out to her provider. And I've heard about 3 stories like that, where I've had people come back and say, thank you, because of you, I now keep a regular check on my blood pressure. Because of you, I went to the doctor, had to get put on medications. So I've heard, a few stories in those lines. So And like you said, if it's just one, if we just can help one, we're moving in the right direction. So just wanted to share those stories.
Thank you so much for sharing those stories with us, Tera. That's the impact that you are making day in and day out, and that this program is making. So I'm really honored to hear them. Thank you for sharing. And on that note, folks, I just want to thank you all for being here with me this afternoon and having this riveting conversation and talking about this really important community resource that could be implemented across our country and make these small but mighty and moving forward changes in our community. So thank you folks again so much for being here. We loved having you. And if you want to come back and talk to us about your barbershop initiative, our mic is always open for you.
Thank you so much, Rae.
Thank you for having us.
Thank you.
If you enjoyed this episode and you'd like to help support CommonHealth, we encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.bcha.org. This is Rae Carkhuff. We'll catch you next time.